How is the TIP transference training different from what most therapists are taught? Psychoanalysis the field of psychoanalysis has developed almost everything that we know about working with transference. The difficulty there is that psychoanalysis is very expensive and takes a very, very long time. And meanwhile, the vast majority of people who get therapy do not get psychoanalysis. Psychoanalysis is a tiny piece of therapy now. And it's because of the training can take decades. That's very expensive. And so most people want to go to a therapist and pay, $50 or $100 an hour instead of $200 or $400 an hour. And they want to see quicker changes in their life and in months. They don't want to see years or 5 or 10 years. So the field has been turning more and more away from psychoanalysis. And yet psychoanalysis is where we've learned so much of what's valuable in the field. So there is this gap. There is this tremendous knowledge in the field of psychoanalysis. And then there are the vast majority of practitioners who have little or no training in transference at all. Some of them some therapists know what it is, can kind of say a definition, but they don't have tools to work with it. And even when there is transference, the kind of transference that's used most often is a positive transference. I'm going to be the good mother. I'm going to be the magical stranger. I'm going to be the helper. And all that does is that pulls in a particular kind of positive transference. And it tugs at the transference, but it doesn't leave any space for the negative transference. And so you can get people who go, and we know this story, many people go into therapy, they get therapy to help with their relationship. They like their therapist more and more, and they dislike at the same time their partner more and more. And there's a really good reason for that. The therapist is taking on more and more of the positive, intimate space in the person's life, while kind of shaking up negative transference, but refusing to own it. So then there's more negative transference that happening in the person's personal life. So there's all sorts of really well-intentioned therapists who don't have the tools to know, they don't know what they're doing with this. And by helping, they can make things worse. So this is the big need. So we can't train everybody in psychoanalysis. That's absurd, right? That's just too much time, too much money. That's not going to happen. On the other hand, we need to help this vast majority of the other 99% of the therapists. So what do we do? So around trauma, because the transference are so strong, that I've pulled out from psychoanalysis just how to work with traumatic transference and stress patterns, and just pulled those out. And I'm trying to help get those to the vast majority of therapists who could do much better work, and get stuck much less often if they just had these basic tools.